Staying in the Western Cape, the province is using over 76 tons of oxygen in its public and private hospitals each day. According to the province's head of health, this is a significant increase from just 27 tons in the past year. The public hospitals account for nearly 70% of the oxygen usage. Joining me now to talk about the province's interventions in dealing with the peak is Western Cape Premier Alan Winde for more details. Premier Winde, firstly, thank you very much for joining us on the program. Just talk to us through the situation in the province, on the numbers you are seeing as cases and death rates are continuing to rise.
Correct. Well, in actual fact, the cases, we seem to be hitting a plateau now, which is a bit heartwarming. In actual fact, our R rate, or the reproduction rate, is now getting closer to 1. So if we look at the last 7 days, primarily the last 4 of the last 7 have seen lower numbers than the previous, than the first 3. So for me, it's a good sign. Of course, oxygen usage, death, those numbers will continue, even though it looks like we've plateaued. Definitely in the garden route, the numbers have come down. And across the municipality of the city of Cape Town as well, every region has slowly but surely come down, except we're now starting to see the pressure in some of the other outlying areas. But it looks like, and we're holding thumbs, that we're reaching now the top of our peak. But as you say, our hospitals right now, 3,289 people in our hospital system with COVID-19. That's across public and private sector hospitals today.
Now, according to the Provincial Health Department, the Western Cape province is expecting its peak in second wave COVID-19 infections in the coming weeks. What provisions are being made to deal with another surge in cases?
Well, of course, what we've done is, as you said earlier, the oxygen usage, it's way higher than it was before. I must say that the team were excellent over the weekend. Really, as we start to reach new milestones, having to make sure that we've got enough supply. We were over the amount of supply that the province's companies can produce. So in engagements with those businesses over the weekend, we've got extra supply coming in, being trucked in now. So we have a supply of up to 90 tons per day, whereas, as the earlier inset, as Dr. Kuti said, 48 tons per day is what we're using, with a peak of about 76, but going up to about 90. And we've put in extra beds as well. We've still got the R300 Hospital of Hope with 330 beds in it. And then we've been putting extra beds in a number of the hospitals, existing hospitals across the province, wherever we could. And we've also built in Mitchell's Plain primarily a number of extra beds. And right now we've still got the possibility of an extra 130, but we're just holding back on it right now. We'll bring those extra 130 in if we need to, but right now our model looks like we can deal with it.
So with plans in place to not only provide additional beds, in terms of the additional healthcare staff, where exactly would they be placed and what kind of care would they be providing?
Okay, so we've also in the last while looked at contracting more staff. In actual fact, staff are quite an inhibiting the availability, because the first peak, as the Western Cape was ahead of many of the other provinces, we could contract staff in from other provinces. This time around, the Eastern Cape was first, then the Garden Route, and now the rest of the province. And we're seeing now in KZN and in Gauteng. So we can't contract extra staff in like we did before, but we have got about 1,300 more staff in the process of bringing them online to help with those pressures, and we distribute them wherever is necessary across the province, making sure that that front line is supported as best as we can, as you say, we're moving into the peak, and hopefully we are actually at that peak right now.
So such a situation would also require that the Provincial Health Department work on improving turnaround times for available beds. What's being done in this regard?
So, of course, we've got dashboard management systems, making sure, and we've got a bed bureau system which has a look at where there's an available bed and how we actually would move someone towards that available bed. Also triaging as best as we can to actually create the space. And then, as we said, we've also put in the extra beds as a buffer as well. and so quite a stringent management system of those beds. But we also are finding that, in actual fact, people are, as we've seen, using more oxygen, and in some cases even needing a little bit longer in hospital than before for recovery. But we've got pretty stringent and rigid systems in place to make sure that is managed.
So in recent days, we've also heard from two major medical aid schemes announcing that the cost of COVID-19 vaccines will be covered for their members. And now this also follows the health minister's own briefing on the national government's vaccine rollout plan. Just talk us through your administration's own plans and the collaborations you'll be undertaking to ensure that the people in the province receive a jab.
Okay, so first of all, obviously we've got, we saw the presentation by the minister on Sunday evening, and we also note that they are saying one single procurement process. And of course, what the province needs to do is make sure that we've got our logistics program in place, our systems in place to deal with it. And it's not only about the program of getting the vaccine to the various clinics and inoculation spaces. It's also making sure we've got the wherewithal to do it. Are there sufficient gloves, needles, everything that is needed within that value chain of getting those vaccines in place? And then also we understand, that it's all got to be verified through SAPRA. But as a province, we are also, looking to find out if we can even help as well to get sooner vaccines in place. But, that's what we're trying to do at the moment.
Right.
But of course, we are also making sure that we've got the full plan on the rollout of those vaccines as soon as they arrive, that they can get distributed across the length and breadth of the province. Obviously, also depending on which vaccine it is, because different vaccines need different cold chains, but then making sure that there is a model to respond to that we can get those vaccines to the public as quickly as possible. Also with a system that says frontline workers first, and then once you've got frontline workers dealt with, then elderly, etc. We've got a system in place of who gets first and when.
So this one procurement system which was announced by the health minister has also sparked some criticism, and notably from the DA, which raised concern with this one procurement system. Just give us your thoughts on the matter.
So obviously we note that. Also note what the DA has said, and being a DA government, and that's why I say at the same time, I'm also looking to see if there are any other avenues, because of course what we must do is everything in our power to make sure that we get vaccinations as part of our strategy to making sure that we can get our economy going, to making sure we can get people back to ordinary lives and save lives, as many as possible. So we're doing whatever we can to make sure that we expedite this process.
So as we wait for a vaccine, what's your message to the people of the Western Cape with regards to ensuring that they stay vigilant and suppress the spread of the virus?
Absolutely. I think it's been phenomenal, this seeing the reduction in trauma over this, especially this New Year weekend. That really created lots of space in our trauma system, and that those resources could then be focused on COVID-19. As I said in the beginning, I've been watching the numbers in hospital very closely, and in the last 7 days, the last 4 of the last 7 days, we've actually seen a plateauing of total hospitalizations in the province. And so my message is, everybody, please, let's just keep doing the same thing. We've got to keep flattening this curve so that we can actually get back to work, that we can actually move forward. We've got to be able to do that. But we've first got to make sure that we do get this curve flattened.
That was Western Cape Premier Winde just talking us through some of the interventions that they are putting in place in response to an uptake in the number of cases concerning COVID-19.